Hello, everyone. Thank you for joining us today. My name is Brittany Doyle. I'm the founder of Wise Health SF, which is a public health consulting company located here in San Francisco, California. We are working in collaboration with the Department of Status on Women to bring forth Free Your Mind SF, which is a mental health awareness campaign designed to increase access to free education, resources, and treatment within marginalized communities. With this campaign, we have a series of events planned throughout the city. They will be taking place between now and October, and we'll be sitting down with a few leaders that are working, developing, and innovating to address mental health, like the amazing Dr. Marianne Jones that we have here today. Dr. Marianne Jones serves as the CEO of Westside Community Services, which provides family-centered behavioral health and human services to communities impacted by substance abuse, HIV, mental illness, violence, and high incarceration rates. With more than 30 years of experience as a clinician, grassroots program developer, and senior administrator, Dr. Jones is recognized as a visionary leader in community-based behavioral health with expertise in Joint Commission accreditation and Medicaid-funded programming. Thank you so much for joining me today.
Thank you for having me.
Yes, yes. Okay, so I'm going to ask you a series of questions. We're just going to get right into it. Can you tell us about the mission and vision of Westside Mental Health Services?
The mission of Westside Mental Health is to provide services that meet the needs of our local African American community. So there are two parts of that. One is to make sure that we have Black clinicians available for the community, but it's also to train people who aren't necessarily from our community on how to work with our community. And so that is really our goal.
Yeah, so I did not know that the focus was on African American community. I thought that it was a general organization that provided services to everyone. So that makes it even more special. So what inspired you to step into your role and lead the organization? And how long has it been? You said 20 years?
Yes, I've been with Westside for 20 years. And, my story starts when I was a teenager. Nathan Hare was my first therapist, and then Thomas Hilliard was my second therapist. And so that just put me on the trajectory to go into the field of mental health. And after college and doing my doctorate, I moved to the East Coast and did a postdoc. And then when I came back in 2004, my aunt, Naomi Gray, who was on the Health Commission, introduced me to the CEO at Westside at that time. And I initially came to Westside as a clinical director, and then in 2010 became the CEO. So really it's related to my love for my community. I grew up here in the Fillmore. I knew many of the founders of Westside. And Westside was founded in conjunction with the Association of Black Psychologists. So a lot of Black clinicians have come through Westside. And that made it special for me that I knew people like Wade Nobles or Naeem Akbar. These are people that were instrumental in bringing community mental health to our community. Westside is the first African American based community mental health center in the country. It's founded in 1967 because of the Civil Rights Act. So for me, it was just sort of a natural fit, and I've been excited to be at Westside and to continue in this role.
Oh yeah, that's great. That's great. So I lived in Fillmore, and I remember when Westside used to be St. Paul's Lutheran School, which was like a small all-Black Lutheran school in the Fillmore. So it's good to see that the building is still being used for greatness. Now, when it comes to receiving services at Westside, what is the process like? Does someone have to have a referral, or can they just walk into the center and enroll into services?
Well, we have different programs, but our goal is to be able to meet people where they are so that anyone can just walk into Westside and get services. Oftentimes, people come in through our crisis clinic. Our crisis clinic provides same-day services and medication for people who need it at no cost. So you can come in, have a psychiatric assessment, and then receive medications from our on-site pharmacy. So some people come in that way. Other people may come through adult probation. You may come through Black to the Future. There are a lot of initiatives in the community. And so our programs really range from serving people that are living with severe mental illness to wellness-based programs. And in between there, we have programs specifically to serve returning citizens, formerly incarcerated, through transitional housing and also mental health support services for them as well.
Nice. Now, I know that mental illness, there is a spectrum of illnesses, but what is the most significant challenges that you see that are affecting the Black community in San Francisco right now?
Well, I think that trauma is sort of an overused term, but I do believe that we are managing the symptoms of intergenerational trauma. And because of our history with the system of mental health, we don't have a lot of trust in the mental health system. So I think people are facing a range of problems, from depression to anxiety disorders to just wanting to be well. We talk with people about self-care, but we don't even really know what that means.
Right.
It's like, do I just go on a retreat for a week? And in most cases, people are struggling with mental health issues and are unable to find a place that addresses their unique issues that may take into consideration spiritual health and also nutritional health, and just a range of issues that impact health in our community. Mental health is health. There really shouldn't be a separation. I never understood why we separate mental health, but for that reason, we have a natural reluctance to seek out mental health services because of we don't want to be pathologized. Right. We don't want to be told we need medication. We want to be able to have options. And in fact, Westside, when it first started, was at odds with some of the other programs in San Francisco, because Westside wants you to be able to come in and have access to whatever you need. So if you want medication, we want to make sure you have the best Black clinicians that can assess you. So we have Black psychiatrists, Black nurse practitioners, Black social workers, Black peer advocates. And so I think that this helps us to meet the diversity of needs in our community.
Right. That's amazing. So I went and I pulled just like some general data for the city, just to see, where we're at right now. And there's some new data, but there's a lot more old data. And I don't know if I'm correct in saying this, but there should be a push in more research when it comes to mental health, especially here in the Bay Area. But what I found for San Francisco is that approximately 22% of adults reported needing help for mental health or substance use issues in the recent years. Psychological distress is higher, and we know this, among those living below 200% of the federal poverty line. In regards to maternal health, Hispanic and Black African American women reported higher rates of prenatal depressive symptoms. 26% of high school students reported prolonged feelings of sadness or hopelessness, with a higher rate observed among Black and Filipino females. And mental health issues are pervasive among the homeless population. And as we know, as of 2024, there were 8,323 homeless, many of whom face severe mental health challenges. And we see a lot of this playing out in the streets every day. So can you talk more about how economic instability, the housing issues that's plaguing San Francisco right now, even the social inequality and how that impacts the mental health of our communities?
Well, I agree with you that we need more research. And as devastating as these numbers are, I think that it's probably worse than what we're seeing. And so I think that people are suffering. And we tend to focus on issues, one at a time. We don't think about the fact that a person that is unhoused may also have mental health issues. So getting them housing, but then they move into a place where they're socially isolated, may exacerbate their symptoms. And so I think that all of these, that this is really an issue of intersectionality. When you're dealing with all the isms, you're dealing with the fact that, the economy is getting worse, even though they're telling us it's getting better. For many people are really struggling, and so those things are actually work to make it more difficult for people to manage. So many of us are able to manage symptoms. We go to work every day, and we may come at home and be exhausted and be depressed, but we're able just to keep it going, largely because we've had to as a community. We have not had the luxury of saying, like, I am really stressed out, I'm gonna take a week off.
Right.
And so I think that as we look more at our community, and particularly among highly functioning people, it's people that have severe mental illness, it's a little, it's not that it's easier to pinpoint some of the issues, but as an example, people that come into Westside that have schizophrenia or bipolar disorder, when they come in, we have showers. We have places they can wash their clothes. We serve hot meals. So that's one way of meeting the need. But on the other end are people like us that may feel like they don't have a place to go.
Right.
So some of this data does bring us into the equation, and we do see it when we look at prenatal health.
Right.
And the infant mortality rates that seem to be getting worse. There is still a statistic that says that Black men are 10 times more likely to be diagnosed with schizophrenia when they have depression than white men. So that means that when we're going into clinics for services, we're receiving services that are really incompetent. And so if you get started on medication for schizophrenia, that's going to impact your life differently than if you actually were treated for the depression that you came in with. So I think that there are just a lot of issues, and most of them evolve around people not really knowing, who we are and what our issues are. And we're constantly told that we should be resilient. Well, resilience has been something that has been forced upon us since slavery. You could take it, it's okay. In fact, before slavery, or during slavery, there were no mental health disorders diagnosed in slaves. Once slavery ended, they developed these lunatic asylums for the Negro insane. And they were like plantations. So you would go in for mental health services, but you'd be working in the back of a plantation. And so what we've learned is that services have not met our needs. And this was in my mother's generation. They stopped those Negro lunatic asylums in 1967. That's when Westside was founded. So that means that, our parents and their parents really had to deal with an inept mental health system, and it continues today. So as lives become more complicated, we have no way to manage or address the issues, for example, that young people are dealing with social media. We have not looked at that, and because we are not included in research studies, we don't know the impact on our community, except for the fact that we see suicides going up. We see a lot of substance abuse, overdoses, that we are overly represented in the data that we're able to pull from the Department of Public Health here.
Yeah, everything you're saying is so important, and that's why it's important that Westside and the representation that it's represented well in the community. Having that presence for, like you were talking about, the Black doctors, the Black clinicians, the Black service providers, to be there. Because how important is it to have cultural sensitivity when providing mental health services? Can we talk about how important that is?
And it is very important. And it's not a matter of just putting a Black clinician with a Black person, or I could say that about other ethnic groups. Because we primarily serve the Black community, I could speak to us. It's a matter of having people that have lived experiences of the experience that people that you are serving are coming in with. One example of this is with our substance abuse programs. We have a methadone program. We also run a group of transitional housing programs that house about 250 people, mostly African Americans coming out of incarceration. Well, we have to hire people that represent that community, that are in recovery, that can see the people that are coming in and see their potential in a way that a traditional clinician, no matter what their ethnic background is, may not be able to see. So we've seen that this is really important, and it's also important within the context of the modalities that you use. You know, San Francisco is very big on harm reduction. Westside has harm reduction, but most of our programs are abstinence-based. So we see this as culturally specific for our community. We do not do well in a setting that allows you to use drugs 5 days a week, and then, or 2 days a week and be clean the other 5 days. So this means that when people come to Westside, we have a very low recidivism rate. People come in and they are able to graduate. 1/3 of our workforce are people that are formerly incarcerated. They're able to see themselves in leadership positions, and this impacts their mental health. We don't just hire people to clean up and to do things at the lower levels. Many people go on to become clinicians. They go on to become administrators. They go on to become advocates. And so I think that this is part of the cultural sensitivity that you need across the spectrum. When you look at children's programming, you know, it's useful to have young people working with young people. If I go into an elementary school, they may not be able to relate to me. You look at our child therapists, they are younger, they are in tune with the issues that younger people are facing, and so this makes a difference in how the community is able to receive services, and is the reason why we generally have waiting lists, because although there are other providers like Westside, Westside has a long history in the city. It's not that we're a better provider, and we have trusted relationships, but we are able to bring a diverse group of people to serve the needs of the entire community. Older adults, you know, if I go in for therapy, I'm 63 years old. I don't want to be with a 22-year-old intern.
Right.
And the other piece of this is making sure that we are not using interns to learn on our population.
Right.
So this is something that happens in the city system. We believe that the people with the most serious disorders deserve to have people that are the most seasoned. And so that's all a part of cultural competency. That means that's why you have to have Black psychiatrists and not just Black peer advocates, and then you have the rest of the staff, which is what I think you see in many of the city clinics, which they say is because of recruitment, but we believe it's important, and we've been able to meet the needs in that way.
Yes, definitely don't send a trainee my way. Like.
Yes. It's an insult.
Exactly.
Insult.
You know, my issues are way too serious for that. So it's like, no, I don't want that. But no, I understand that. So in the work that you've done over the years, can you speak to like any culturally specific or unique mental health practices or beliefs that you've seen in our community, or that you've tried to uplift within Westside? Just like anything unique. I'm just wondering what's out there.
I think what's unique is being able to incorporate spirituality into treatment, which means that, you know, people have to give informed consent. So it's very important for when people come in for therapy or for any services, for you to meet them where they are and give them whatever it is that they need. But being able to do that within a system that's built on insurance, that's built on the federal guidelines of Medicaid, which says you have to develop a treatment plan, you have to address symptoms, you got to do 1, 2, 3, 4, and people should be healed in 6 months. Well, that's not how mental health works, in my opinion. So what we've done is to create programs that allow people to come in and out of services. We recently started a clubhouse because we recognize that people living with severe mental illness have nowhere to go during the day. So they come in, we have art classes, yoga classes, they make puzzles, they go on field trips, we serve hot meals, they have a place to go, and they run the clinic. So it's not run by clinicians, it's on a different floor at Westside. And so I think that having those type of services that aren't just based on, oh, you have depression, let me give you cognitive behavioral therapy in 6 sessions and then, you know, send you along. People that have been with Westside for years and years, for decades. And I think that you have to have a system that allows people to do that and not just come in and get a quick intervention and then move along. And also being able to provide mental health services without having to diagnose people. So many programs around the city, because they're receiving Medi-Cal funding, to receive services, you have to have a specific set of disorders. that qualify as severe mental illness. So that means if a person comes in, maybe someone's been murdered in front of their house, they're devastated, they don't meet Medi-Cal criteria, they're not served in most programs, but we're able to serve them because we raise money so that we can serve anybody who comes to the door, whether they're low income or they're middle income or high income, whether they're a resident of San Francisco. Many of our residents live in other places because they've been pushed out of the city. So we don't say that if you identify because you grew up in Geneva Towers, we have a place for you in our program. And so I think that these are the types of things that we do that make a difference in the lives of the people that we serve.
Yes. Now I want to shift our conversation and talk a little bit about community accountability. So we know that Westside can't do all this work alone. It's a lot of mental health needs across the entire Bay Area. So how can community leaders and organizations collaborate with you all to promote mental health awareness and services?
Well, I think one project that we've been involved with for probably the last 8 or 9 years is called Black to the Future. It was a collaborative that was developed by Supervisor Shaman Walton and Dr. Cheryl Davis that brought together 17 organizations to provide wraparound services. So there's violence prevention, there's an educational component, there's a mental health component, there's a physical health component, and I think that we need to build more collaborations like this so that people aren't just siloed. If you could only come to Westside and only get mental health, what about all the other issues? And these type of collaborations allow us to be able to address issues like diet, as example, to provide interventions for families in the community. Many of us I grew up having Cocoa Puffs for breakfast in the morning. I don't know how we made it through school, but being able to help people just make shifts in their daily lives within settings that aren't clinical are as important as clinical settings. So you have to have spaces for people where they're not anxious about even coming into the building. At Westside, some of our buildings have more than one entrance. So you come into one entrance, you leave out another one so people don't see you coming in or exiting. The methadone clinic is like that. People need privacy. And so I think that we have to build better bridges. And in this system, there's actually more competition, which is unfortunate. So providers tend to compete with each other because they see, Westside as an example, as a large provider. And they may think that we are getting more funding than we should be getting, and so they may not make referrals to us. But that's I think that's just the politics of city living, and it's not unique to San Francisco. And the more that we're able to come together and collaborate and look at the specific health needs of our community, the better the services will be. When people come to us, we can give them food cards for groceries. If there's been a case of domestic violence, we can put them in a hotel. We couldn't do that without our partners because we're not funded to do that. So by bringing in partners that allow us to do that, like the Mayor's Office of Housing as one example, then we're able to really meet people where they are. It doesn't make any sense to work with someone around depression if they're hungry. So when you come into our clinics, you eat. We always have food available. We have hot food available because people are hungry. And the same thing with students. When, after school programs, we go into the schools, we bring lunches in, we bring snack packs for them because, they're hungry. So I think a big piece of this is being able to utilize these resources and to also not discount resources because they're not Black focused. We work with a lot of different communities that help us to provide services to our community. For example, the Church of Latter-day Saints, they fund our program at Third Baptist that provides services every Friday night. We go on field trips, we do a lot of work, but we also have a psychologist there that's available to provide support to the children and to the adults. So I think you have to really look at the resources in your community and then build upon those and to constantly focus on what's in the best interest of people, not what's in the best interest of Westside getting all the numbers and all the money, but if there's someone else that can do something better, then I want to be able to refer people to them. And there are people in the community, people like Lynn Westry at the Department of Public Health that deal with violence intervention that we don't have anyone. We don't have a Lynn Westry. So it's important for us to have those relationships with people in the community so we can wrap ourselves around the many needs, the multifaceted needs of what our community needs.
Yeah. I know a lot of community members that take like individual accountability for, helping their neighbor when they're in crisis, or, they're the person to call when, just anyone is in crisis in the community, or, just being that person of support for other people. Now, do you all provide any sort of trainings for someone like that, an individual that, wants to, learn more or be able to help out more? And if not, how can an individual play a bigger role in impacting mental health in their community?
So I think what we've looked at is that on that continuum of providers, how important it is to have peer advocates and health advocates. And so we do offer trainings. We try to bring people in and help them to be able to be supportive in their community. So that person with minimal training can now be a vector, can direct people to different services. And because that person is trusted, they're really the gatekeepers of the community. We can make sure that they have the training that they need, and that they also have the resources that they need. So I think that this is very important in our community, that we do have these people who have historically been the gatekeepers, the caretakers, the people that everybody goes to, that they are equipped with the knowledge, but also to understand what their role is and their scope. They know that they're not doing therapy, and that's good. And so just like I can't practice medicine, I'm not a physician, we want people to develop competencies in these specific areas. And I think peer advocacy and peer liaisons serve a really important component of mental health, and we need to be there to support them. There's some programs that I think do that very well. Westside does it, but I would say the YWCA, they do it really well. They go out and they're in the community and they're identifying those people and making sure that they're also taken care of, because sometimes the people who are the caretakers, they're dealing with vicarious traumatization. If everybody comes to you and tells you their problems, you're affected by that, not just mentally, but throughout your entire body. I mean, that's how stress impacts all of us. So I think that's how we deal with it.
Yeah, when you say that, it makes me think of when you talk about the Bayview YMCA. Is that the YMCA you're talking about? Yeah, the Bayview YMCA. It makes me think about their Harambe program, the barber shop that is led by Craig. I can't think of his last name, but Craig from Lakeview. And I just think that is such an amazing program, an intervention, a safe space for community members to come. I mean, because people already go to the beauty shop anyway, and talk. And the hairstylist, I'm sure, hears it all, probably internalizes a lot, probably dreads customers when they come in because they know they're coming with trauma. And so it's good that there's services out there to prepare people like that, to educate them and to provide them with the tools and the skills to be able to effectively help their clients and community.
Yeah, one thing I will add about that one of our partners, Positive Directions Equals Change, they used to have a hip hop shop in the Bayview, and we're trying to recreate this. So in the front was a barber shop, but in the back they had clinicians and medication. Oh, nice. And I was like, that's kind of cool, because then there's no stigma.
Right.
And it was, I think some of the concept is like head inside and out, that it's important for us to be able to go to the barbershop. And these are cultural institutions for us, much like the churches. So I think that that we need to have more of this. We're in a collaborative. The Bayview Y is in the mental health cohort in the Black to the Future collaborative. So we work really closely with the Bayview Y. Yes.
Good. Now, earlier you brought up the word trauma. Trauma-informed is a key word that floated around the city for many years. And I know now when people hear the word trauma-informed anything, they're like, oh, not again. But, we think about how there's a lot of organizations out here that do not integrate a trauma-informed approach in the work that they do. And I personally feel like it's very, very important to have some form of, healing or safe space, just a trauma-informed approach in what they're doing when serving the community. Do you feel that way? Do you think that even though trauma-informed is starting to become, is no longer a buzzword like it used to be, but the purpose behind it in ensuring that it's integrated in community?
Yes, I think that, from my clinical training and my mentorship with the Association of Black Psychologists, we have always done trauma-informed therapy. We understand that people don't come to you as a diagnosis. What we want to know is how you got to this place that you are. Mm-hmm. We don't say, look at this person and they've got all these diagnoses and, but what led up to this? So I think that trauma-informed has become a bit of a catch term, and clinicians are put through training, but I don't think that all people that have had trauma-informed training can actually provide trauma-informed care, because it really requires a shift away from traditional Western medicine that sees you as a walking diagnosis. We have never done well in that system. We have been over-pathologized, and so, some of the things that we're dealing with, you should be dealing with. If you dealt with a lot of trauma, and you said, well, it doesn't impact me at all, I'm just the happiest, healthiest person in the world, then I wonder, well, where'd you push all that down? Where is all of that? And not that I can go to someone and say, I know that you're dealing with stuff, but when you have circles and people are able to talk about it, because they've kept it down, they have to be able to go to work, then you realize that some of their fear is that they're going to be pathologized, but then they'll start to open up more about what's really going on with them. So I agree with you. I just think that the term itself is not helpful, because people go get a certificate, but they're still, when they see you as a walking diagnosis, and I don't think that's useful. We're such complex beings that we cannot be minimized. We never say a person is schizophrenic. A person is living with schizophrenia. We distinguish that. So I think that that's a trauma-informed approach, but for us it's been really important that you are not your diagnosis, much in the way that you are not just the person that people see when you show up in the world. You're not just a teacher. You're you've got a lot of other stuff going on, a lot of other identities, a lot of different roles that you play. And so when we look at trauma, I think we have to look at it within that context. And also for us, when we look at complex post-traumatic stress disorder, looking at our trauma across generations. I do certain things because my mother did certain things, and just being aware of that. Now, for example, we were trained not to go to the bathroom outside. We had to wait till we got home, because that's how it was. They had colored bathrooms. That can create some trauma in and of itself, but sometimes we have to look at the origins of some of our traditions. That's not, I wouldn't really qualify that as a cultural tradition. It was more of an adaptation so that we wouldn't be rejected, so that we wouldn't end up in jail, so we wouldn't end up killed because we went in and drunk out of somebody else's water fountain.
Yes, that when we talk about the generational trauma and generational mental health, and it's like you see your family you've been seeing your family doing this your whole life. So even if it was out of sorts, it's not wrong to you. It's the norm for you, but it might be not normal for other people.
And you might have to challenge it. One example is intermittent explosive disorder. My mother had this. She would go from 0 to 100. A certain trigger would take her off, and she would just curse you out. It just was her way. So I noticed that I had a little bit of that. But looking at where it came from, having a place to explore it, has helped me to manage it. Sometimes I still go off, but and that's a diagnosis, actually. That's
I'm like, do I have that? I need to look that up.
But for people who've been so disrespected,
right?
It's like a trigger, which may not even be disrespect, but that's how my mother may have perceived it. That's how I may perceive it. And then, we kind of pass it on. So being able to look at those types of things that we've brought along, that may not be healthy, because what does that do? That creates inflammation in your body. So I curse somebody out, but then I walk around all pissed off, and I'm creating anxiety inside, my heart rate is up, that person's gone on and called me a crazy lady. But I'm
Thinking
dealing
nothing else
now with the
about
health
it.
effects of that.
Yeah, that's very, very true. So as we close out, I want to bring back up again your many years in this industry and all of the great work that you've done in this city. What has been some of the most inspiring moments that you've witnessed in your work here?
I think watching the developments of marginalized communities within the Black community come up and say, we're going to do it a different way. We're not going to do it the way the health department does it. We're not going to do it the way the experts do it. And so that's inspirational for me because I'm watching us evolve, as a community and figure out different ways to address the many issues that we face. And so I think that that's one area. But another area that's been really inspiring for me is watching people move through a crisis or be able to utilize therapy in a way where they can change their lives. I mean, where they now may feel free from whatever they were dealing with. And so knowing that you make a difference in someone's life is makes all of this work worth it, in spite of all the challenges of dealing with funders and billing and productivity, that at the end of the day, we're really talking about people's lives and holding hope for people and, helping people move into a new place and understand themselves more. And being able to witness that makes this all worth it for me.
Yeah, I agree. Over the past couple of years, especially during the pandemic, when the community had to come together and basically come up with our own system of care and our own way of caring for each other, and even addressing social isolation, and despite being sheltered in place, still keeping people active and getting them out the house, the resiliency that I saw in our community. So I would have to agree with you on just our capability to come together to heal and, and to serve each other. So.
That's right, we made it work. We were doing church by Zoom, we were having parties by Zoom, and we kept that connectedness that I think is what keeps us healthy. Without that, I think we'd be in bad shape.
Yeah, I would agree with that. Well, thank you so much for coming in and speaking with me today. I really enjoyed this conversation. I learned a lot, and I hope that the viewers learned a lot too on how they can play a part in addressing mental health in our communities, in our families, in our schools. We'll actually be having more conversations with school leaders, men talking about mental health in, with our young boys. So I'm very excited in keeping this conversation going. And thank you again for joining us today.
Thank you for inviting me. It's an honor and pleasure.
Thanks.
Thank you.
Yee.